Today I want to demonstrate a physical assessment on a preschool child. Clarence is here as a 5-year-old kindergarten student for his physical assessment. Hi, Clarence.
Hi.
The first part of the physical exam is really an assessment of his skin. Clarence, I need you to take your shirt off so I can see more of your skin. Gaining cooperation from a child at this age, to give simple commands are really telling them exactly what it is you want them to do rather than to ask them to do something. You notice I said, Clarence, I need you to take off your shirt. I can also assess while he's doing this some of his fine motor skills. He's able to button, or at least to unbutton his shirt to get it off. I can inspect his skin and see that it's smooth, it's consistent in color, it's moist in the palms, no visible scarring, color appropriate for a child his race, lighter in the palms. Fingernails are also a part of the physical assessment of the skin, and you can see that his nails are contoured appropriately, well adhered at the nail bed, cut nice and short. Hair is included in the assessment as well. He has hair consistent with his racial expectations. Distribution is even, though cut very short in a quite stylish new haircut. I want to inspect Clarence's skull. I want to feel for any lumps or bumps, making sure that the contour is smooth. There's no depressed areas. It's very much nice and smooth. His neck. I identify the sternocleidomastoid muscle as I see it here to see if the trachea is midline. Trachea is midline. I can palpate with 2 fingers. Sometimes it's actually easier to do it from the back. I can palpate the landmarks. Turn your head to this side, please. Back toward me. Look toward me, Clarence. Swallow. In swallowing, sometimes the actual soft tissue of the thyroid can be felt moving smoothly down to the fingers. The lymph nodes are a very important assessment in a child this age. And I palpate in front of the tragus, the external ear, for the preauricular nodes. And to use both hands and palpate bilaterally simultaneously allows for comparison of node size if there is any node development. Behind the ears, I palpate for the posterior auricular nodes, which would be just above are on top of the mastoid area. At the corner, the angle of the mandible, the tonsillar nodes can be palpated. Halfway between the angle of the mandible and the chin, the point of the chin, I palpate for the submaxillary nodes. At the tip of the chin and midline, the submental nodes can be palpated. Behind the ear, I again want to palpate for the anterior cervical nodes, which run superficial to the sternocleidomastoid, palpating behind that toward the trapezius, the margin of the trapezius muscle, where I can palpate the posterior cervical nodes. And then midway between the mastoid and the protuberance of the occipital area, I palpate for the occipital nodes. In all of these areas, particularly in anterior cervical region, many children Clarence's age will have palpable nodes. Those nodes can be palpable up to the size of 1 centimeter, as long as they are non-tender, non-erythematous, well-defined margins, mobile. In this age child, that would be considered normal. The only other area where we palpate for nodes is here. Supraclavicular node is where the sternocleidomastoid attaches to the clavicle. Any node of any size palpated in that region would be considered abnormal. To assess the eye, the first assessment would be the visual acuity. In a child who's 5 years of age, 20/30 or 20/40 would be considered normal visual acuity. In addition to that, we would also like to have some information about his peripheral field function. And what I would do is stand in front of Clarence, separated by 2 feet. I need to keep my hands at his eye level and ask you to tell me when you can see the you have to look at me. You see the fingers wiggling? Okay, good. Extraocular function is an important part of the assessment of this child. The corneal light reflex, if I shine the light held about 9 inches in front of Clarence, I look to see if the light's reflected in the same place in each eye. This helps to evaluate whether or not the muscle balance is appropriate. I also want to know if he can follow the 6 cardinal fields of gaze. Clarence, I want you to look at the light. Good job. Lateral. Great. And then as it comes to your nose, super. Pupillary response can be seen by directly shining the light into the eye. And then as the light comes to his nose, once more, his pupils constrict. A cover test is another way of evaluating his muscle balance. I can shine the light in his eye and observe whether or not the eye that's uncovered has to search for the light if it moves when I cover this eye. Clarence, watch the light. Good. And when I uncover the eye, to observe whether or not this eye shifts when it's uncovered. Let's do it with this eye. No. Looks good. We've spoken earlier about his eyebrows, his eyelashes, lashes being a part of the eye exam. To push slightly the corner of the eye, you can see the lacrimal duct. Bilaterally, without any discharge. The sclera is clear. The iris are round. The eyelids, look up, Clarence. The upper lid is at the margin of the iris, look down. And the lower lid is also at the margin of the iris. To examine internal functions of the eye, small children we can do, and even on Clarence, we can get a red reflex to examine the left eye to my left hand and to my left eye. Clarence, you need to look that direction, please. Look right there. Again, entering the side, you can actually find the disc to be pale yellow. Round. Keep looking that same place, Clarence. The vasculature, again, is readily identifiable. Very good. Sometimes that's hard to do. We were able to see a red reflex, and often in small children, a red reflex can be the screening that you can do. It allows you, the red reflex allows you to know that the light is actually reflecting off the back of the eye and that there's nothing clouding the passage of that light to the back of the eye. So it's a way of ruling out cataracts. We can assess his ears as the next part of his physical assessment, and by looking at his head, I would assess the external structures to be the tip of his penna is parallel with the corner of his eye, and his ears are symmetrical. They have a slight rotation of about 10 degrees. Nice and flat against his head. And with an otoscope, and a pneumatic bulb, I will pull down and out in a child this age in an attempt to straighten the external canal. I will gently place the speculum in the external canal, and I see the canal is pink with a minimal amount of cerumen, and the cerumen is moist and brownish. I can see the landmarks of the TM. I can see the umbo, the malleus, the light reflex, which is reflecting off of the pars tensa. I can see the pars flaccida. The TM itself is pearly gray, and with an introduction of a small amount of air with the pneumatic bulb, I see that the TM moves very well. I would examine his other ear. Doing great. Again, noting all the landmarks, the appearance of the external canal, evaluating the cerumen that is present, and testing for mobility of the tympanic membrane. Good job. Auditory function in these children can also be assessed by pure tone audiometry, and that is a very important test as children start into school. I'm going to look at the internal structures. I can see that the septum is only slightly deviated. It's, for the most part, midline. And with a speculum, I can visualize internal. The mucosa is a little bit darker than that of the oral mucosa. You can see the inferior turbinates, the middle meatus, and the middle turbinate. And the same I will inspect on this side. It's nice and pink. The mouth, you can see his lips are symmetric. Open your mouth, Clarence. Inside internal lips and the buccal mucosa. Open just slightly so I can see. Pink, smooth. He has lost already he's lost 3 of his deciduous teeth. He has 2 permanent teeth. 2 lower central incisors are now permanent. The left lateral incisor is loose and it's about to fall out, and the right lateral incisor is missing. The remaining teeth, he now has his lower 6-year molars, a little bit ahead of schedule. But by 2.5 years of age, children will have cut their 20 deciduous teeth, and then somewhere between 5 and 6 years of age, those deciduous teeth start falling out, beginning with the lower central and then upper central incisors, soon to follow. They're nice and smooth. I see no dental caries. His palate, his hard palate, is not movable. It has the appropriate ridges. It is symmetrical. It's an arch appropriate for, thank you, this child. His soft palate is movable. It's a smoother palate. Turn just a little bit this way, please. Okay. His tongue is pink and smooth. Stick your tongue out. Say ah. Uvula is midline. Say ah, big ah. Big ah. Stick your tongue way out and say ah, there. Okay. I can see the anterior and posterior pillars. His tonsils are present. Posterior pharynx is pink. Say ah one more time, Clarence. Ah, big. Ah. Okay, good job. We've had Clarence take his pants off, his jeans off, so we can better assess his abdomen. As a part of his assessment of breathing, we need to see his use of his abdominal muscles for breathing. Children with breathing patterns established at about 6 years of age, particularly for boys, will have more abdominal respiratory pattern. Girls at this age will have switched from abdominal respiratory patterns to a more thoracic pattern. Clarence is still at this age using, and will continue to use, as men do, their abdominal muscles. His respiratory rate is very easy. He's not laboring at all. We see no retractions. The skeletal structure, we can view his clavicles, his ribs, his chest to be very sturdy. And to assess his skeletal structure from posterior, we also see these ribs, his scapula are symmetrical, his spine is straight. To percuss the chest field, you can do a simple, to get a resonance. The vocal fremitus. Say, how now, brown cow?
How now, brown cow?
Can be felt as a smile vibration if I'm lateral of the sternum. And say it again. How now, brown cow?
How now, brown cow?
Okay. I can percuss the posterior. The vocal fremitus being medial to the sternum. How now, brown cow?
How now, brown cow?
And once more.
How now, brown cow?
Good. Take a listen to you. Take a deep breath. cardiovascular assessment would begin by evaluating blood pressure. A blood pressure in a child this age would be somewhere around 94/55, with a slight range and variation. The pulses also need to be evaluated, and we can evaluate his carotid pulse by palpating the sternocleidomastoid. Between the sternocleidomastoid and the trachea, I can palpate his bilateral carotid pulses. They're strong, regular, full. His brachial pulses. Are strong, regular, and full. And the other pulse we will palpate is his femoral pulse. Okay. Let me just palpate his chest to see if I can feel any beats in this aortic region. His pulmonary. The mitral, tricuspid, and then I can palpate here at the apex for a good strong heartbeat. To auscultate for his heartbeats, I can identify second intercostal space on the right to be his pulmonary. Second intercostal space on the left at the margin of the sternum to be his aortic. The third intercostal space on the left at the sternal margin, I can hear the mitral. Between the fourth and fifth on a child this age, at the left sternal margin, I can hear the tricuspid. The midclavicular line, at again the fourth intercostal space, I can hear the apex. He has a strong, regular heartbeat. The S2 is actually heard best here in the pulmonary area. S1 is best heard at the apex. Some kids may also have an S3 that can be identified at the apex. Murmurs can often be heard in children, particularly young children, and often are innocent murmurs. Murmurs are usually during the systolic beat, early systole, and graded on a range of 1 to 4 or 5. Murmurs of 1 to 2 being the very mildest, quietest, have sort of a musical pitch, are felt to be most likely innocent murmurs. Anything greater than a 2, a 3, a 4, or a 5 are felt to be more pathological. In this position, I'm going to move on down to do an abdominal assessment on Clarence. He is a child who has nice, smooth skin. I can see that there's symmetry, no scars. Umbilicus is centrally located here. I can palpate the umbilical ring, and he has no hernia. I see no abdominal movements. I do see only that he's his respirations, but I see no other movements in the abdomen. So just listen. I want to make sure there are bowel sounds in all quadrants. The gurgling. I hear no bruits, no rubs. I can percuss for his liver. To percuss down until I hear a dull thud. His liver is expected to be somewhere 2 3/4 to 3 inches. His spleen can actually be identified if I percuss the mid-axillary region at the ninth rib. I should be able to identify a dull sound there as well. Then with just some light palpation, I will try to not tickle Clarence. Take a deep breath, Clarence. And I want to palpate at the costal margin for his liver. Does that tickle? So I'm palpating for the organs that... Take a deep breath. And for his spleen, which is not palpable. In children, okay, if you put your fingers under mine, and palpate for other abdominal organs. Sometimes you can actually palpate a bladder that is full. In this abdominal area, we also want to can better palpate his femoral pulses. For inguinal nodes, as well as for hernias that might be here. We want to evaluate his muscles and his bony structure, but we want to really know about his musculoskeletal system now. So in order to see how well you can bend and move, you know how to play Simon Says?
Yes.
All right, let's play Simon Says. Simon says, bend over and touch your toes. Great. Simon says, stand up. Simon says, bend over backwards like this. Great. Simon says, bend to your side. Now the other side. I want you to twist, but this time I need to hold your hips. I want you to twist your shoulders this way and then the other way. Twist them as far as you can go this way. This way. Other way. As far as you can go around. That's great. Okay, Simon says, touch your chin to your chest. Put your chin down here. Simon says, put your right ear on your right shoulder. Don't raise your shoulder. Put your left ear on your other shoulder. Your left ear on your left shoulder. Right ear on your right shoulder. Other side. That's right. Now twist your head. Other way. Look this way. And look the other way. Great. Put your hands out in front of you. Simon says, put your hands out and spread all your fingers. Simon says, turn them over. Make a fist with your thumbs on the outside. Great. Now jump up on the table and we'll play some more games. Okay.
Stand up.
No, you can sit down. You can put your feet right here. Okay. I want to see this muscle. Make this muscle really big. Oh boy. That's a big muscle. Other one. Okay. I want you to hold that. I'm going to pull down on your arm. Make this muscle big. Stay that way. Can I pull it? Don't let me pull it. Don't let me pull it. Don't let me push. Ay, ay. Okay, this way. Do it again. Okay. You've just evaluated these big muscles that you showed me, and they are strong. All right. Raise your arms way up over your head. Straight up over your head. Simon says lift, 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 high, high, high. Okay, push down. I'm going to pull them down. You hold it up. Hold it up. Okay, bring your arms down. Simon says put them down. Terrific. Can you do your hands up and down and up and down? Terrific. The neurological examination of a child this age is done to a great extent throughout the entire physical exam. To assess his memory, we could ask, and a child this age is expected to repeat a sequence of 4 numbers. Clarence, listen and repeat these numbers after me. 9713.
9713.
Very good. Speech is very good, and that we've assessed throughout the exam as well. The cranial nerves are a large part of what we've done in terms of other activities, particularly eye function, reflexes, particularly his gag reflex, movement of his tongue. But there are some very specific things we could do. Stick your tongue out and touch your upper lip. Upper lip. Right. I want you to shrug your shoulders. Very good. And he's just demonstrated another one. He can grimace with his teeth clenched and make a face. All of which is demonstrating, again, the cranial nerves being intact. There are some cerebellar proprioceptor tests that I can do at this point, and to do that actually would be an evaluation of some gross motor function and some fine motor function. Clarence, stand here on the floor and play some more games with me, please. Can you move away from the table so that you're not balancing using the table, and stand on one foot and the other foot? Great. Can you walk that, see the line on the floor, putting one foot, put your heel to your toe, and come this way. Walk right down the line. That's still tough for 5-year-olds. I want you to walk on your tiptoes toward me. All right? That's good. Walk on your heels. Go back on your heels. Walk on your heels. Great. Now you can have a seat back up here again, and we'll do a couple of other things. We've actually tested him to do pronation and supination of his hands, and do that real fast. Okay. Put your thumb to each finger as you move fingers of your hand. Go as fast as you can move. Thumb to finger, each finger. Do it again. Very good. The musculoskeletal part of the neurological exam has been well demonstrated as he so successfully moved through the musculoskeletal exam. The reflexes, we do a few of those in children, though it's not as, if all other systems are intact, the reflexes are not nearly as important in children. The patellar reflex, hang your leg very, very limp, very, very loose. Just let it hang here. Don't, you know. You got to let it be really loose. Be really loose. Like it's just a rag doll. they anticipate the hit, the strike, and it's difficult to evaluate in children. Do the bicep. It's a good one. You can see that. Just leave your arm very, very loose. Very, very loose. That's a good one. Okay. Do the triceps. Can you hang your arm just let's let it hang here. Rest it on my hand. You don't hold it, let me hold it. Let me hold it. Good job. Okay, we've just finished your whole health assessment. You did a great job. And I am so happy to say that you are a healthy, healthy boy. It's such fun working with preschool-age children. It's a time to watch them grow and develop, and it's a very exciting time in their lives, too, with starting school and anticipating that exciting event. I'm happy that Clarence has this wonderfully healthy exam today, and I thank the Hilliards for coming and being a part of this video.